All right, so thank you so much to Sinclair for having me here today. I am a cosmetic dermatologist, board certified, right outside of DC, and my practice is celebrating its 20th year. And I was trying to think, how long have I been in partnership with Vior? It's been probably a very, very, very long time. I love their innovation. They're great people, and they really stand behind their equipment. And so I hope all of you learn that on a first-hand basis. So speaking of innovative, I'm here to talk to you about the EnerJet, which is a crazy, crazy cool device that I just love having in my office. And so since I'm cosmetic derm, I do a lot of consultations, right? So there we go. A lot of times the patient will come in and you're trying to decide, which way do I want to go with this patient? I have a lot of tools in my toolbox. Do I go with a device? Do I go with injectables? Or does the patient lean one way or another? Sometimes they lean one way or another, and strongly so, because they've seen it on this glowing screen and they've got this idea in their head and that's what they want, right? Even though it might not be ideal for them. But this device is an interesting way to kind of bridge these two worlds together. So you have a device that is using, most of the time what I use with it is the filler for the kinetic lift. And so you're kind of bridging these two worlds together, and a lot of times, even if you have someone who's in one camp or the other, they are amenable to this idea, they like this idea. So how this works is that it's spraying a therapeutic material in through the epidermis into the dermis, and when it hits the dermis, it spreads through. So there's this spray of material through the dermis, and that's where you get the kinetic component. So that kinetic energy or movement through the dermis is actually causing micro trauma, and what that does is it causes stimulation of fibroblasts, which increases your elastin and your collagen, your glycosaminoglycans, and all the building blocks of the skin, all the things that we're always trying to help, right? So that does all of this. So what you can do with the EnerJet, the one thing that I already mentioned, the kinetic lift, that's my favorite. That's what I use this for the most. And when I'm trying to explain it to a patient what it does, well, I'm going to shoot this filler in without a needle through mostly into your scalp, and it's going to lift. And sometimes they don't quite understand. And the way to sell it is you say, do you ever do this in the mirror? And they go, yeah, I do that in the mirror, right? That's what it does. This is what you get from the EnerJet. It's beautiful. And just a side note, I did one, and I've done fillers, I've done devices, I try to stay on top of things, and in spite of all of that, I was noticing a little change on the jawline that was making me kind of crazy. And I did an EnerJet. I looked in the mirror and I wanted to cry. I was so happy because I had my youthful shape back. So that's what it does. Not just that, you can help your dermal component really, so wrinkles and deflated skin that needs plumping. That's what you can do with it. You can also work on scars. And I have a case I'm going to go over later that is a beautiful case to exemplify that. So again, how does this work? This is really unique. It's using this high velocity jet stream to blast a therapeutic material through the epidermis, and the little tiny pinpoint opening is really only about 200 microns, so it's really keeping the epidermal architecture intact. Then what it does is once that material hits the dermis, it kind of sprays through, and that's that kinetic component that I'm talking about. It's these little nanoparticles, and this nanoparticle burst through the dermis is creating a stimulation through microtrauma, and it's stimulating your fibroblasts to make more of the building blocks of the skin and to rejuvenate. Here's a little video to show a little bit more about what I'm trying to explain here. So there's no needle, which is a huge selling point. Here's that hydrating effect. And then you have a longer improvement because you have collagen and elastin building. So your improvement is really going to go on beyond the life of your typical filler. And here you can see this is a dyed solution being sprayed into a gel, and you can see how it's just spraying out through that gel instead of staying in one little spot, right? So it's a high velocity jet. Again, you have a really tiny entry point. Depending on the pressure you use, you can go up to 6 millimeters down. And you can use hyaluronic acid in your lift, you can use neurotoxin, you can use PRP, you can use corticosteroid in a scar, so it's really versatile. This is a patient of mine, so this is the EnerJet in action. It's loud, if anything, so I tell my patients it has more bark than bite. I would say, again, I had this done, I would say it's a 2 out of 10 on the pain scale. Maybe a spot or 2 is a 3, but it's really very, very well tolerated. So what's it doing? How's it working? And of course, we've looked at this, and there are some beautiful studies showing and supporting all of this. So there's this controlled trauma, and so you're inducing this wound healing cascade. And also there's this stress, or mechanical stress on the fibroblasts and the matrix, so that is also helping to induce collagen remodeling. And on top of that, you have whatever you're spraying in there, which most of the time is going to be your hyaluronic acid, and you're stimulating your collagen, your elastin, your glycosaminoglycans. Again, your skin quality is improving with this. So you have dermal thickening, remodeling, and better hydration. So here you're going to see how this works. I was worried it was going to flip. What's the timeline? So there is an immediate effect because you're spraying in a diluted version of your material, okay, of your hyaluronic acid. So there's a little bit more volume to it initially, and you see the lift pretty much right away. So when I'm treating a patient, I'll treat half, and I will show them in a mirror, and they will see this brow is higher than this one, this cheek is coming up, this jawline's starting to come up compared to the other side, and they're all excited, and then I flip them over and do the other side. So I love to do that and just take that minute while you're in your treatment, and they really appreciate seeing that. So you have that immediate effect, then you have the longer effect of having that HA in there for hydration and water attraction, and then again that micro trauma from the disbursement of the material and that kinetic blast through the dermis that induces your collagen and your remodeling. So here you have a histologic study where you can see again the epidermis remains intact. And in the dermis, you can see a lot of vacuolar change, right? All those little vacuoles, that's where your HA is, the diluted HA. And really, the important thing here to note is the blood vessels, okay? The blood vessels are intact. There's no material going into the blood vessels. So you have enough energy to spray in and through the dermis, but once it hits that blood vessel wall, it's being bounced off a little bit there, so it's not going through, which is a great little safety mechanism. So what can you do with this? You can do a kinetic facelift, which is, again, my favorite thing to do. And here's a little kind of beginner's diagram, if you will, of how to do this. And once you play around with it, you're going to kind of develop your own technique, but I always like to kind of chase the wiggle, if you will, where they're moving the most. That's where I like to just pile in that HA to get more of an effect. You can go through necklace bands. It works very, very nicely. Of course, you can do this with a needle too, but this is a beautiful effect. And with the EnerJet, you have that kinetic component of a longer lasting collagen stimulation. So keloids, this is where, honestly, when I first got this, I was like, yeah, sure, okay, I can just inject the keloid. I've been doing that for decades, right? Why do I need the EnerJet to do this, I have a needle and I have the solution. I just put it in there, right? But as most of you know who've done that, sometimes it's really, really hard to get into that keloid. Keloids can be really challenging to push the solution into. And it takes a lot of time to get that softening. Well, I have a case that I'm going to show you in a little while that just blew me away with the efficiency of how this works. And when you think about it, again, this is spraying the therapeutic material through that tissue, right? So think about it. If you're having trouble pushing that solution into that scar, you're probably just getting a little small depot of that corticosteroid in one spot, okay? Whereas if you use the EnerJet and it is able to spray through those fibrous bands, and then you have tiny, tiny bits of corticosteroid all through that fibrous band, right? All through them. Instead of concentrated in one spot, you get a much quicker and better result. So here's a little kind of schematic going over what I just said again. You know, you're getting a depot with the needle versus using the EnerJet. And you can think of that the same way as with the kinetic lift, right? So I'm saying, well, I'm going to use this and I'm going to fill through here and lift up the skin. Well, anybody who's an advanced injector knows that you can grab a cannula and a syringe and you can go in there and you can depot some Restylane or whatever your favorite filler is, and you can get that lift, right? And, you know, and I've done that myself, but I'm not going to get the kinetic effect using the cannula and the syringe that I would with the EnerJet. So there are advantages of having that material just shot through the dermis like that. So downtime, right? That's a huge, huge thing that I'm always asked about. I practice outside of DC where everybody is like hyper busy and hyper important and they can't have the downtime. So this is beautiful. I always explain it to my patients saying, okay, in each place where I inject the material, you're going to have a welt. And that's going to go away in a couple of hours. And in a couple of days, there's, well, I should backtrack. I say there's a welt, and in the middle there's a red spot. That's where the material goes through. And that goes away in a couple of days. So the welt is a couple hours. The little spot is a couple days, but it's so small, and really most of it's hidden through the hair if it's the lift, right, that you're not going to notice most of it. But even for the people who are doing dermal thickening, right, where it's right on the face, or if you're doing necklace bands or wherever, your downtime really isn't that bad. And you can see this is less than a week, and she looks pretty good there, right? So if she threw some makeup on, I'm sure she would be fine to go out, which is important because, you know, if you've been practicing long enough, you'll have more than one person walk in the door saying, I have this massively important event in, you know, 7 to 10 days, and I forgot to take care of this. What can I do, right? And you're like, are you kidding? I mean, if I whip out just needles and syringes, right, they can bruise. No matter, you could be the best injector in the world, there's always that chance. And there's always some swelling with that. But with the EnerJet, I'm like, okay, let's do an EnerJet. You're going to have just a couple days with these little red dots. And then, you know, a day or two beforehand, you can do Dermafuse, you can do Pre-May, and they look enhanced and refreshed for their event. So it's great. So studies, of course, this has been studied. And as you can see, as we progress through this slide, the pressure is increased. And so that's adjustable on the EnerJet. And so as you increase the pressure, you are increasing the depth of where the material is going. And here's some histologic studies showing increased collagen, increased glycosaminoglycans, and increased fibroblasts to the area that was treated. And of course, those are the busy little cells that are making all the good collagen and elastin. So here you have a kinetic facelift study, and showing that there is, in fact, a lift of the brow and there is dermal thickening after treatment. and a dermal thickening study. And what I like to highlight with this is, as you can see, there is an improvement even up to 6 months. So yes, there's an improvement at 3, but even greater improvement at 6 months. So keloid scars, as I said, I've been kind of won over on this one. And you can see there's an improvement in every matrix here, but what I want to really highlight is that the pain and the pruritus was greatly, greatly decreased in this study. And the patient I'm going to show you later, that was one of her biggest problems, was the pain that she was in. So here we're going to go through some before and afters. And I should ask also, I forgot to ask, how many of you have an EnerJet? Okay, great, awesome. So you'll see, you'll know when you're looking at these what you're kind of looking for. You're looking for a raised brow, increased malar or better malar positioning, and you're looking at your jawline. This is just one treatment, but you can already see the beginnings of this, right? And here, this is a patient of mine, and she's currently in treatment, and she's a friend of mine, so she let me use her photos. And you can see she already has a little bit of a raised brow. Her malar positioning is improving, and her jaw is starting to firm up, and she's still doing her series. Here's another friend of mine. This is after 2, and again, you're looking at her brow is raised, her malar position is improved, her jawline is starting to straighten out better. And this is a dear friend of mine after 3, and she's a great example of someone who had a lot of laxity. And so one of the questions that I had that I was pondering when I got the EnerJet was, who does better, right? Is it the person who has like almost no movement when I go like this, or is it the person who has a lot, right? How much wiggle does this person have? How much laxity? And so I, kind of thinking about it, when something's kind of tight and you pull it, you'd think, okay, well, that's going to be a lot easier to raise that up than if something's kind of loose and then I go to pull it, right? It's going to take a lot more pulling to finally get what I want to pull up, right? I hope you're following me. So in my mind, I was thinking, well, it's the person who doesn't have a lot of laxity who's probably going to be a little bit easier to pull up. So here comes my friend in, because I was like, I need some before and afters. I have this new device. Can you come in? Oh, yeah, sure. So I go to treat her, and it's like a Shar-Pei. Her skin is going all over the place, and I'm going, oh, my Lord, I had no idea. And I'm thinking, to heck with 3 treatments, she's going to need 6. I'm going to have to put so much filler in here to get her to, like, lift up, right? What am I going to do? So I treat her. This is after 3. She did fantastically. And you think about it, and you know what? It's the kinetic part of all of this, because she has the same amount of filler in her that some of the other people do after 3, right? And so a little bit more after the one you just saw from 2, right? She has a little bit more, but her result is better. And I think it's because people who have a lot of wiggle or a lot of laxity, their extracellular matrix is so damaged, right, that they are the people who need this the most. So think about it. And you can fill them and do all this stuff here, but if they have all this damage extending around, right, because the face is not in isolation, it's like a puzzle, everything's connected. So you have all of this connected, damaged skin all over, right? So you have laxity kind of coming from all over. And when you start to correct that and you start to pull that up and recreate that collagen and elastic base and get some glycosaminoglycans in there, the whole thing starts to correct. So she's a beautiful example of that. And since then, I think that the people with more wiggle do better. Here's one with just 1. Some dermal plumping, again, beautiful results. And here on the décolleté, and that's 3 months after 2 treatments. Again, these things can take time, right? You're looking for remodeling. And with acne scars, you can also have a nice improvement. Anyone who's treated acne scars knows that's an excellent improvement. These are some very, very difficult ice pick scars. Again, acne scars. And this is my patient. And this is the patient who I've been kind of mentioning throughout. And she came to me. She had had a facelift years ago and had horrendous scarring around both ears, front and back. Horrible, right? So she went in for a cosmetic procedure and wound up with these horrible scars, has to wear her hair down. She gets big earrings to hide the rest, and she's in pain. It hurts her. It pulls. She came to me because I have a lot of devices, and she had already failed traditional treatment. So she's already been injected with corticosteroid by several doctors and gotten nowhere. And she came to me thinking I had some sort of magical laser that would correct this. And I said, I don't have a magical laser, but I have the EnerJet. So we did a treatment, and she came back after her first with tears in her eyes thanking me because she was in so less pain. I mean, the pain was almost gone, and she was thrilled to death. And she had tried and tried and tried. And here with one treatment, I had taken almost all of her pain away, and the scars already started to look better. It was so exciting. So this is after 3, and she's still in treatment with me, so I'm hoping to get even better results. But you can see her scars are really starting to come down. And here's around the back.
So for that, to maintain that, is it like she has to constantly come back to do that, or it's going to be like that forever?
So once we get these fibroblasts under control and get them to stop making, too much collagen, I do think she'll be fine because she does not have ongoing trauma. Now, if she were to do something else where the fibroblasts get angry again, right, and they make too much collagen, then something could come back, but I think she's going to be fine. Yeah, and here's the other ear on the back side of that one. So, you can see this is a big problem for her, and this was a simple solution. Again, I know I could not get that result with a needle, and in fact, she has failed treatment with a needle, and here she is with EnerJet, and it worked beautifully. Here's some other scar cases from some other physicians. And it's a really bad case. Now, they used 5-FU with that one. So why EnerJet? You can treat anybody with this, right? All skin types. You don't have to worry about burns. So this is something that anybody who's well-trained can do. You have to know what you're doing, but it's very easy to learn. There are no needles, which is a big selling point for a lot of people. Some people get nervous about needles. And you can do it all year. You don't have to worry, have they been in the sun or whatever. And why I love the EnerJet, again, it's comfortable. Even guys will do it. I'm sorry we're picking on the guys today, but when it comes to medical procedures, they're not as hardy as the women. And so this is easy. There's no needle, and I tell them, I've done it. It doesn't hurt. I give it like a 2 out of 10, and they like it. And they also like that there's almost no downtime. All the marks are hidden away, right? And they leave, and you can almost not tell that anything's done unless I'm going along on the face a little. Again, needle-phobic patients love this. This is a nice way to get filler into a needle-phobic patient. Again, think about necklace lines or dermal plumping or anything like that. Very natural look, okay? A very natural look. And sometimes your injectable patients or whoever, even if they're not an injectable patient already, the facial structure is, they don't need more filler in the mid-face, right? But they want more of a lift. They're done. They're going to start to look weird, and you don't want them to look weird because they're your card, your advertisement when they walk out the door. You don't want someone looking weird. So this gives them a very natural look, and because it's lifting from here, right? Instead of just pulling out here or lifting right along the cheekbone. You know, I had the other day this gorgeous Norwegian woman come in, and she's got these cheekbones to die for and all this, and she looks amazing, but she's starting to get a little lax. And so this is a beautiful solution for her, because you don't want to, you know, mess around with her beautifully, naturally structured face. So this is perfect. Again, the best and quickest keloid treatment I've ever seen. It's won me over. I think it's fantastic. And again, I can't harp on enough how natural this looks. So very easy, very cool. And we're going to have a demo in just a little bit. And I thank all of you for your attention. And if you have any questions during this weekend, I'm around. So I'd love to meet all of you and talk to you. Thank you.